Right now, if you're an inmate here and the criminal justice system deems that you are unfit for trial, you have such profound mental health issues that you don't know what's going on in the courtroom, or you can't assist your attorney with your defense, they send you back here to the jail where you wait for a bed at a mental health hospital, and eventually you go there, you get treatment, and hopefully you get well enough to be able to stand trial. This new program, though, brings those mental health services here into the jail. The state says it saves time and money, and it's worked in other places. But an attorney that I spoke with is concerned about this. She says if someone has such serious mental health issues that they can't stand trial, they shouldn't be in a jail at all, let alone receiving even more treatment here.
Good afternoon, everyone.
In front of the Wake County Detention Center Monday, State Health and Human Services Secretary Dev Sangvi, along with Wake County Sheriff Willie Rowe, announced that the NC Rise program is coming to Wake County, bringing mental health professionals into the county jail to help treat inmates who have such serious mental health issues that they can't stand trial.
Will function similarly to a day program where they're in our program from 8 till 4 or so in the day, and then they'll go back to their housing unit where they have already been housed.
The program is voluntary and offers things like individual and group counseling, medication management, and classes about the criminal justice system.
That targeted treatment and specifically that focus on their legal knowledge and ability to proceed is what's going to be unique about this program that's not provided otherwise.
They've tried this in Mecklenburg and Pitt County, offering treatment inside jails instead of inmates waiting for treatment at a mental health hospital. In-jail treatment costs about 1/5 of in-hospital treatment, and it also cuts down significantly on trial wait times, with treatment taking an average of 50 days instead of 140. The shortened time frame gets defendants to trial more quickly, which Sheriff Rowe says is good for everyone involved, especially victims.
One that's been a victim of a crime, until there's some closure, they continue to suffer. And so we believe that the earlier we can get a court date so that people can be held accountable, then it serves to the greater good.
But attorney and advocate Don Blagrove worries this solution is misguided.
Doesn't sound bad at all, but the reality is that people who are deemed incompetent to stand trial, like that is not a designation that is come by easily. Those people have significant mental health problems. And the idea that there's some kind of quick fix that can happen around a lunch table inside of a jail room in group therapy is problematic in and of itself.
This new program is also taxpayer funded.
These capacity restoration programs are funded in part by an unprecedented investment by the General Assembly of $835 million for behavioral health.
Don thinks that money could be better spent offering more beds at mental health hospitals for those who have profound mental health issues, saying a jail is not a conducive environment for treatment.
I just feel like this is a very nice way to give the community a sense that mental health is coming inside of the jails, when in reality what is coming inside of the jails is a Band-Aid for people who have very serious mental health issues, who need real care from people, real sustained care from people who can help them get to a place where they can be healthy.
One thing that both sides can agree on is that the mental health crisis here in North Carolina is growing as both the state and community works to find solutions. At the Wake County Detention Center, Sydney Schofield, ABC 11 Eyewitness News.